Good evening and welcome to another Government of Jersey Facebook Live event. Tonight we're here in St Helier to talk all about the COVID-19 vaccine and answer your questions about that subject. Maybe you've already had your vaccine but didn't get the opportunity to ask the question that you wanted when you were at the Fort Regent or when the team visited you at your care home. Perhaps you've read something in a newspaper or even heard a rumour about the vaccine and it's just giving you that little bit of doubt you want some clarity on. Sitting behind me in the studio here is a panel of experts who are leading Jersey's drive to get the population vaccinated. They're going to answer your questions that you're going to provide to me this evening. Before we go on to listening to your questions and putting them to those experts, take a quick look at this video. So we've just seen there, nearly 21,000 jabs have been given to more than 18,000 islanders. A fantastic start, a fantastic achievement, and we want to know even more about it this evening. So a bit of housekeeping first. We're all socially distancing here. The crew behind the cameras have got their masks on. For the purpose of making sure that you can hear what I'm saying, I'm going to remove this mask and invite our panel of experts to just pull their mask down when they're answering their question, and then they'll put them back on again, just in case there's any doubt there. So, who are our experts? What I'm going to do now is invite each one of them to introduce themselves, tell them a little bit about who they are, what their area of expertise is, and why they're here this evening. So first, a very familiar face, I think, to all islanders, Dr. Ivan Muscat.
Hello, Ivan Muscat, Deputy MOH and Microbiologist.
Hi, my name's Becky, Sherrington. I'm head of the vaccine programme. I'm a nurse by background.
My name's Ross Barnes. I'm the operational lead for the vaccine programme.
Hi, my name's Paul McCabe and I'm the Chief Pharmacist at Health and Community Services.
So that's the team behind the vaccination programme. But tonight is not going to work unless you get involved and you submit your questions. It's your chance to put your questions directly to the people behind this programme. Many of you have already been doing that through the phone number and through the email that was provided earlier in the week on social media, but there's still lots of opportunity for you to get involved. How do you do that? It's really, really easy. What you need to do is go onto the internet and Google slido.com or enter the address slido.com, slido.com. When you're in there, you don't need to give your name, you don't need to log in, you don't need to register, you don't need to download anything. It can be completely anonymous. All you've got to do is put in the code, and the code tonight is 445566. It's the same as the COVID helpline. Once you've done that, you're able to type your question. You don't need to put your name. You can put a little marker on it or some initials or something like that. It'd be great if you do give your name, but feel free to make something up or put it down as anonymous, and we'll do our best to make sure those questions are asked. So don't forget slido.com, and it's 445566. Now, we've got about an hour to get through the questions this evening. There are plenty that have already come in. But what I'd like to do, first of all, is invite Becky to explain to us all, as the lead in the programme, why we're here this evening. What's tonight all about?
We felt that as a team, rather than giving out information that we think people want to hear, this was the opportunity for us to talk openly and transparently about the programme and give the island the chance to ask us questions about the programme, about the vaccine, and any questions that people may have if they're worried, or the kind of unhidden answers that people haven't asked before. So it's an opportunity for us to be open and honest and to have that discussion with islanders.
Great. Well, on that subject and discussion with Islanders, the questions I can see are coming in already. As I say, they're coming in on top of the ones that we've had. So let's get the ball rolling. And we're going to be jumping around subjects. I'm quite sure about that. Maybe we start here from an operational point of view. We've got an anonymous question that came in early this afternoon. You've seen fit to vaccinate all of our lovely older folk in the care homes with 2 doses within 21 days. So why should I, and this person is saying that they're 80 years old, not receive the same 2 doses within 21 days? Because I think there's a gap, isn't there, between them, Dr. Muscat, at the moment, a bit of a longer gap.
Thank you. So initially, when we received the vaccine, we also received the clear directive from the MHRA and the JCVI to give the doses of vaccine that we received 21 days apart from each other. And that is what we did. During that period of time, however, the MHRA and the JCVI updated their advice and said that what should be happening is that we should be giving 1 dose to as many people as possible, as soon as possible, to make very good inroads into the outbreak of COVID that we were seeing. So we then transferred from a 21-day gap to a 3 to 12-week gap between the first and the second dose. This advice from MHRA and JCVI was, of course, based on their analysis of the data that was available to them, and they do have a very good expert group of analysts who worked out that it was safe and very appropriate to approach the outbreak and the vaccination schedule this way.
So if somebody's had, was just about to get one, perhaps they thought they might be getting it 3 weeks apart, and then the advice has changed, should they be worried?
No, because we know that the protective level given by the first dose is very good and lasts for that sort of period of time. We also know, of course, that as it turns out, that the people who are most in need of protection were the people we vaccinated first, and that is the care home residents. They're the most vulnerable. People who are living outside care homes, even if they're over 80, have a 10 times lower risk of death from COVID should they catch COVID compared with people in care homes. So apart from following the advice from the regulatory authorities and JCVI, it also fitted in with the needs, if you like, of the individual groups of people.
Okay, right. Thanks, Dr. Muscat. Just remind us who the JVCI is again.
It's the Joint Committee on Vaccination and Immunisation, and we follow their advice in Jersey because we work so closely with them.
And they're based in the UK.
And they are based in the UK.
That's okay. Right. So, Ross, this might be one for you here. We've got somebody who's asking, they're under 50, they don't have any particular health issues. What's the plan to roll out when are they going to know when they're going to hear about getting the vaccine?
Sure. So, as Ivan said, we're working with the JCVI guidelines on what order we approach the population, and mostly based around age, but also for, as you mentioned there, clinical reasons why they may be more vulnerable than certain age groups. At the minute, the advice goes out to up to the over 50s, so we've planned that out with the available vaccine that the UK is giving to us as a proportion of what they're receiving as well. And that takes us currently on first doses out to the end of March, which is our target, to have vaccinated with 1 dose all the over 50s and all those under 50 with a medical condition that puts them at higher risk. Once we've done that, we'll then move on to giving a second dose to that same population group, as that is within their 10 to 12 week period after their first dose. And that'll take us about just over a month to do with the current vaccine that we have. Clearly, that's quite changeable with how supply changes. So we're working on how we can do that as quickly, as efficiently as possible. Whilst we're doing that, we'll then be refocusing and looking at the under 50s and the remainder of the population and the vaccine availability at the time on how we can then start the rollout for that process. But at the minute, very much focusing in line with the JCVI, the over 50s and those medically at risk who require the vaccine now.
And so how do these people find out when they're going to get the vaccine? They're going to be written to, or does it rely on people themselves registering?
No, so we work with our communications team, and as we model out our vaccine supply and when we're able to open to each tier, we're very much hand in glove with them. We work out a suitable timeline that we have a relative amount of certainty of the vaccine supply that we're getting. We can then choose the date of when we're going to open to that next tier, and communications are put out across social media and in the general media to alert the population that their age group or other category is coming into play for vaccination.
So I mean, I know at the moment we've had, I think it's 96% of over 80s have received at least their first dose of the vaccine. That means there's a 4% somewhere there that haven't. Do we know? Are we going to try and get in contact with those, or is there a particular reason perhaps that they might not have received it?
So the point that I stress is that when we move through the tiers, we never close to a tier. So every tier that we move down, you've always got the opportunity, if you've either missed because you've been unwell or if you didn't want it initially but you change your mind, we will always offer that opportunity for you to come and get your vaccine. So as we move through, we clearly need to get onto the next tier and the other people at risk who do want it, rather than those that may be not sure and waiting for a bit more time before they get theirs. But that small percentage at the end of each tier, we'll always keep an eye on them. We'll always encourage them to come and get their vaccine. It'll always be open to them. But of course, it's a personal choice, and the person needs to be willing and able to have the vaccine, but also medically fit to do so. So having not had been diagnosed with COVID within a 4-week period, having no other medical condition that might prevent them from having a vaccine in a safe manner. But as I say, we'll always keep the opportunity open to all islanders.
I mean, is there a chance that somebody might have not seen that piece of communication or not seen the website? I mean, are we just assuming anybody who falls in that small percentage that hasn't had it have chosen not to have it, or could there just be that risk that they've not known it was their turn?
Potentially, but again, we keep on with our communications and we're making sure that we try to capture those people. And as we said, it's a community programme and we're really focused about the community. So if you do think that there are people out there that could fall into that category that may not have seen, may not have access to social media or the other media outlets that we're using, then please do spread the word, keep looking after each other. And if you can encourage your friends and loved ones to come and get the vaccine, then please do so. It's safe to do, and we're willing and able to do it for them.
Yeah, that's a great piece of advice there. Paul, something I know you can look specifically at allergies, reactions, some of the things that people are suggesting might happen. We've got a question in here from somebody who's saying that they've heard that their father has got breathing difficulties. They're worried that when they receive that vaccine, a bit like we've heard, maybe when you get the flu jab, people might feel a bit unwell for 24 hours or a bit. Is there a risk that they could complicate things if they're already in that high risk group?
I would say not. I think if you've got breathing problems, the risks you'll get from contracting COVID are far, far, far worse. There's no evidence that the vaccine will cause any problems with breathing. It doesn't cause an infection. It effectively tricks your immune system into thinking you've been infected. That's why you get an immune response, but it doesn't cause any infection. So it shouldn't present any problems. And in fact, we would recommend people with breathing problems to consider themselves to get vaccination.
So actually, they should kind of get to the front of the queue rather than be worried towards the back of it, if anything.
Yeah, well, obviously we have the JCVI groups of priority that we work through. Depending on the severity of someone's breathing problems, that might place them in a certain priority group for vaccination. But obviously, if they've got any concerns, then they should speak to their GP and discuss it with them to see when and where vaccination might be appropriate.
Becky, just on the subject of GPs there, I mean, was it considered that this programme might have been, I know we've got the fort and I know that we're going to care homes to make sure that we protect our elderly islanders who are in care. Was it ever considered that this programme could be rolled out through the GP surgeries rather than through Essential? What was the thinking behind that?
So, as most people probably be aware, the vaccine itself had lots of logistical problems with it. So we had to keep it frozen. We then had to thaw it. It can only be moved a certain amount of times. So from the point at which it leaves the manufacturer site to the time that it's administered, it can only be travelled a certain amount of times. Is it 4 times? There's 4 times. So leaving the factory to being administered, it can only be moved 4 times.
And obviously getting it to Jersey uses up,
Yeah,
will use up some of those.
exactly. So we have a lot of logistical problems in managing the vaccine itself. We also, it's around vaccine quantities that we're receiving. So the amount of vaccine that we get, we've got an estimate which we can make a rough plan around. But those vaccine quantities, because the way in which it's manufactured, then differs each week. So the only certainty we have about the vaccine that's arriving is within a week's forecast.
Right.
So we have to make sure that we've got the right amount of appointments for the right amount of vaccines. So to put all of that into a programme really made sense to do that centrally. It means we control the exact amount of appointments, we can make sure we've got the right amount of vaccine on the right amount of days, and we can make sure that it's completely safe. So to do it centrally is much more easy to do as a team. So that's the way in which we've done it.
I mean, for those that haven't yet had their jab, obviously we've had nearly more than 20,000 islanders that have had at least 1 jab, some have had 2, who are unsure what to find when they get up to Fort Regent. I know there are videos out there. I know we've seen people in the news who have had their jabs. But I mean, are they at risk going up there and gathering in a crowd? Because we know sometimes what Jersey can be like. Everybody can turn up all at the same time or want to be there first. Are we assuming it's going to be, everybody's going to be spaced out, it's going to be safe?
Yeah, and that was a really important consideration that we had as a team about where we chose the site. So we thought about different places. So could it be in a parish hall, for example? Could it be in other locations? But this is a really, really important public health campaign. So we need to make sure it was incredibly accessible for every population group. So the fort, we know that most people either work in town or live in town. So having somewhere that was centralised was really important to us. So having that space, which was big, meant that people could socially distance when they get there. It's also, by naturally as well, really ventilated. So it means it's a less risk to people in terms of having COVID. We also work really hard with our infection control team as well. And as an operational team as well, we've made sure we work closely with them to make sure that every step of that process has infection control. Just also going back to your question about primary care as well, the whole vaccine team, we've involved lots of different people. So there's a radiologist as part of the team, there's GPs. So the whole team, although it's a centralised team, it is a multidisciplinary team, and we've worked really closely with GPs on the priority groups, as well as working with us at the fort. So it's been a whole cross-island approach, but we've just worked it centrally to make sure it's safe.
I think I've read there's more than 100 involved in that team, isn't there?
Yeah, and
a lot of them are volunteers.
it is.
Yeah.
And so Aisling Adams, our workforce lead, has had the unenviable job to recruit people in just an incredibly short amount of time. And she's done that with great skill. And I don't know how she's done it. She's got over 110 people in post, which includes volunteers, the marshals, the vaccinators, trained them up to use digital systems, taught them how to vaccinate. So, yeah, the workforce piece has been really, really big.
Right, well, thank you, Becky. I mean, just before we move on to the next question, I'm reliably told that a lot of you who are watching on Facebook are actually posting questions in the Facebook chat. We've got people behind the camera who are trying to gather those questions and put them into Slido. Unfortunately, all I can see on my screen at the moment is the Slido questions. So if you are posting questions in there and really want to get them asked, please just go on to slido.com, put in 445566. It'll take you through to this chat room. Ask your question and we'll try our best to get it asked. You don't need to give your name, you don't need to download anything. It's really, really simple. It's just that chance in Facebook, the rate that people are commenting or liking or whatever, your question's being dropped down the order and we might miss it. Okay, so let's move on to something else. Dr. Muscat, I mean, we now know that various vulnerable areas of the island of society are given the flu jab on an annual basis. Can you see Can you see us getting the COVID jab every year?
A lot of people are thinking that that's the way it's going to go for 2 reasons, really. One is that the COVID strain does vary, and as it varies, it may lose some of its susceptibility to the immunity generated by previous vaccines. So you need to keep on top of it in the same way as we do with the flu jab on a yearly basis, of course. And the other is, at the moment, we're not quite sure precisely how long the immunity lasts following vaccination. We've only been vaccinating since about December. Obviously, there have been trials going on before that, and people have started to measure the duration of immunity from the days of the trials, but we don't know how long that lasts for. So for those two reasons, it's likely to be an animal jab, and it may very well come in as a joint vaccine with flu. So you get one injection with two different vaccines in it.
And it may be in the future that's something that's given by your GP, or in the same way that the
It
flu
will
jab is given.
be, yes, will be outside the pandemic situation, and it can then be given through the usual channels.
Okay. So we now have another question here that has come in from somebody called CJ, and they're saying that when where a couple live together and one of them is over 50 and the other one is under 50, is it possible for them both to be vaccinated at the same time, or would it be one first, one the other? Ross, maybe you want to start us off on that one. I suppose the same problem applies if you live with somebody who's in that vulnerable category, or maybe is poorly and needs that vaccination, and you perhaps don't.
Yeah, absolutely. So we had a policy when we were working through the older age groups of certainly people who were close in age but not necessarily in the same category, travelling together to attend the fort so that they could have their vaccination. There's a few reasons we did that. First of all, the people in that demographic could find it a little bit more difficult to get around, so it's much easier if they travel together. They help each other through the getting to the fort and then through the process as well. So we really encourage that. The other important point to note is that those, as we were moving through those age groups, it was a controlled and smaller demographic of people. So we could allow, with the vaccine we had, for those extra people to come through if they were booked, and we could control that relatively easily. As we move down the age groups, clearly the population size of each of those age groups starts to increase. So what we're working on in the policy at the minute is that that policy of, if your partner's within 5 years of you below, will stop at the over 70s. So 70 and above certainly come through together. Below that, we're saying to wait for your age group. The age groups will go down in tiers of 5 down to 50, and then we'll, when we come to planning the under 50s, as I said before, we'll consider that. But at the minute, we're not offering that to come together, just for the sake of the size of the population. If we allowed everyone to turn up with a partner within 5 years, it could potentially up to double that population group which we're planning to vaccinate. And clearly we need to look at the vaccine that we have, the vaccine that we're forecast to get, and make sure that we can offer those appointments to the right people at the right time. So we will be sticking to the age groups from now on.
So I suppose then the advice there is that if somebody within your household is vulnerable, is sort of elevated to getting that vaccine before you or the rest of the household, you just need to be extra careful, the rest of you in the house, to make sure you're following all of the necessary guidance to
Absolutely,
until that vaccine has fully immunised that individual.
Yeah, absolutely. And the general policy of the vaccine programme anyway is that even though you've had your vaccine, you still need to maintain public health guidance and keep your distance, keep your hands washed, and wear your mask to make sure you protect yourself and the rest of the community.
Well, I think that answers, I can see there's been a few questions from that, people of different ages asking. One of them here as well is about pregnant women. Just before you put your mask back on, I just thought maybe we'll just check there as well. What's the plan for pregnant women? When will they get their jab? And even those women who have recently given birth who may still be breastfeeding.
I think I can hand that to you, Ivan, if that's all right.
So at the moment, there is little evidence about the use of vaccine in pregnant women, although based on the generalizations one can make about vaccination, this is a dead vaccine. It's not. It doesn't cause infection. It's not similar to, say, MMR and so on, and therefore can be given in pregnant women. But the advice at the moment, until we know more about COVID vaccination in pregnant women, is to avoid vaccinating pregnant women if possible. But if they are at risk, then you need to weigh up the benefits against the risks of not vaccinating that individual. If a woman has been given the vaccine and finds out she is pregnant, that is not a problem. You just continue with the pregnancy, but you would want to defer the second dose till after delivery unless the woman is at particular risk. There is no contraindication to breastfeeding, and so breastfeeding mums can receive the vaccine.
Fine. Okay. And I suppose then there is that theory that the child is the immunity is kind of is passed on to the baby whilst breastfeeding. Does that apply in this case as well?
What will almost certainly happen is that the mum will develop immunity, and that immunity passes from her bloodstream through the placenta to the baby after 30 weeks gestation, and so the baby will be protected for about the first 6 months, possibly a year of his or her life. But of course, as we know, very young children do not really develop significant disease due to COVID anyway, so they do not really need that protection, but it will be there.
Okay, thank you. Right, so just a reminder, why I'm looking at the computer here, or we're looking at the TVs underneath the camera, which you can't see. We're getting questions coming in via something called slido.com, SLIDO. Google it, jump onto there, and enter the code 445566, and you can ask the question. You don't need to download anything. You don't need to put your name, enter an email address, anything like that. Completely anonymous if you wish. Pop your question in there, and we will do our best to get it answered. Now, another question that's come in here, which has received as well something that you might not be aware of. People can like the questions. You might get on there and find that somebody's already asked the question that you were going to ask. If that's the case, you can like it a bit like you can on Facebook, and that will push it up to the top of the tree as well. And one of them here that's getting quite a few likes is about asthmatics. As COVID-19 is a respiratory virus, why haven't all asthmatics been classified as moderate risk? Paul, over to you on that one.
I think that's a good question. I think asthma is such a wide range of disease state, on people with very severe asthma who end up being admitted to hospital regularly, who are on high amounts of medication to treat their asthma, right down through to some people who only very, very occasionally have to use a Ventolin inhaler because they get out of breath when they exercise or something like that. So to treat asthma as a whole, I think, is difficult because the risk of people depends on the severity of their asthma. So GPs have information about people's asthma and how well it's controlled in their computer systems, and they can use the information in there to pull out those people who are at highest risk because of their asthma, and those people will be in the priority group for vaccination.
And so they then will wait to hear, or I think those applications are about to open, aren't they, for people with asthma? Or moderate risk, I should say.
They are. I think they should get a letter from their GP which tells them that they're in the priority group, and then they'll be able to, depending on the announcements from the team, phone up and make their appointments.
Is that right, Becky? When's that due to happen?
Yeah, that's right. So the letters have started to go out. So we sent them out in waves because this moderate group is quite a big group, and we don't have enough vaccine to do the whole group within that week. So we've split it into 3 different age tiers. So those letters have started to go out. The first letters have gone out. The second lot will go out this week, and then the further lot will go shortly after that. So people should have started to receive those letters based on those age groups. So over the next couple of weeks, people will start receiving that. And as Paul says, we've taken that information from the GP surgeries about who's at risk. The JCVI have been looking at this and modelling it. So looking at who has been the greatest risk over the year. So based on that, they've then given us those priority groups. So given us that information, then that's on our website about who's at highest risk. So we've stuck to the JCVI, and we've worked with our GPs and primary care colleagues to take that information out, and then we're writing to those people based on that moderate risk group.
What if somebody thinks they're at high risk and they haven't received a letter? Is there anything they should do or could do?
So the first thing, it's a good question. So the first thing they should do is look on the website. So our website clearly gives the information about who is at the most clinically extremely vulnerable or clinically at risk. So you can have a look, see what your condition is, and then map where you are if you're in those. If you think you are in that group and you haven't had your letter in the next few weeks, then go and speak to your GP and see if that you've been missed from that. But again, check on the website first, because actually the list of conditions isn't massive. It's quite narrow for the first, the high risk, but then the clinically vulnerable group is a bigger group. But just go and have a look on our website would be my first advice.
Have a look on there, and if you're still unsure, contact your GP.
Yeah, that's right.
Fine. Okay, so that's good advice. Right, Ross, this might be one for you, and this is a really good question that we covered back as well in the government plan debate before Christmas, and it's about university students and where they fall in this programme. Because some have gone back, some might still be here working remotely. Whose responsibility is it to vaccinate them? And also, where do they go for their second vaccine? If you've had it in the UK, but then you end up back in Jersey, do you get the second one here? Are they at risk of falling through the gap? What's the situation there?
Sure. So the first thing I'd say is that clearly we're in line with the JCVI guidance. So if you are a student travelling and you fall within the current priority group tier that we're vaccinating, then you will be eligible for a vaccine. If you're not and you're below the current age group or not medically at risk, then you'll wait your turn as the rest of the population. In terms of the wider point of travelling between here and the UK, we do have a reciprocal agreement in place whereby if you have one vaccine in one place, you will be able to have access to a vaccine in the other and vice versa. The way to do that is if you are if you have your first here and travelling to the UK, you can get in touch with the NHS or a local GP to register yourself and get yourself in the vaccination programme. But again, that'll be within the current operating tier at the time. And likewise, if you have your first vaccine in the UK, if you arrive in Jersey, you can then get in touch with a GP, get yourself registered, and then when your tier becomes eligible, you will be offered a vaccine here.
So without trying to be too specific, because there's going to be many different situations and scenarios, let's say that your son or daughter is at university, has decided to go back to the UK. Maybe they're studying remotely or socially distanced, however it might be. But you as the parent receives a letter in Jersey saying, oh, because your child has got asthma, we're inviting them for their vaccine. What should they do in those situations? Get them to ring their GP where they are in the UK, or?
Yeah, absolutely. So if they can pass on that information and a copy of the letter to their loved one in the UK, then again they can approach either the NHS or a local GP to get themselves registered for a vaccine. If not, then again you can get in touch with us, and we can try our best to get that through as well, to make sure that it's highlighted and we're tracking those individuals who, as you say, might be at risk of falling through. But yeah, we'll do what we can to support that, to make sure they get the vaccine that they require.
Paul, this might be one for you, and it's received quite a few likes there, and I'm sure it's something that's been on a lot of people's minds, because we know, that it takes a long time to develop vaccines for viruses and diseases, and there are doctors and scientists working around the clock, always on some vaccination for something, and there are still people who are a bit worried. I'm sure there are many people who are a bit worried that this seems to have maybe been a bit rushed. It's been quite quick compared to how medicine normally works. Is there a risk that something's been missed? It's been rushed out. Are they going to get side effects? Maybe not in the first few weeks, but it could be in months, in years ahead. What do you say to those?
Yeah, I mean, on the face of it, it does seem that these vaccines have been developed very quickly, but there haven't been any corners cut in the development of the vaccines. What they've done is they've managed to run a lot of the studies and a lot of the work in parallel, so alongside each other at the same time rather than one after the other, which has significantly shortened the time required to develop the vaccines. The clinical trials that they've been through are the same as any medicine would go through, and those trials haven't indicated any significant problems with side effects. Most of the side effects you get with the vaccine are quite mild, sore arm, temperature, muscle aches and pains, headache, and usually come on within the first 24 to 48 hours and then go again after 24 to 48 hours. So there are no signs at this stage that there are any problems with the vaccine.
So people might, if they receive the vaccine, might have a bit of a minor reaction to it, a bit like if they've had the flu jab. And if they do, they're not necessarily to call the hotline to think, oh, maybe I've actually also caught COVID at the same time. So
No, and absolutely not. And in fact, a small reaction's a good thing. It's actually a sign that your body's mounting an immune response to the vaccine. So the aches and pains you get, the headache, slight temperature, are a sign that the immune system is starting to kick in. So it's actually a good sign that you have moderate or mild side effects.
okay, that's reassuring to hear, I suppose, in those instances. So we can see there another question that's come in and got a few likes is, how efficient is the Oxford vaccine? Why is Europe not using that one? So what's the answer to that, Dr. Muscat? I mean, we know there are 3 out there. Can people pick and choose? Is one better than the other? Obviously, Brexit's complicating things for some supply chains.
There are a number of vaccines out there, and a number due to come through. The 2, of course, being used in Jersey and in the UK in the main at the moment are the Pfizer and the Oxford vaccine. The Oxford vaccine has now been given the full green light for those over the age of 65 by WHO and others. It was considered to be effective in that age group from the outset, but people have now rubber stamped it resoundingly. It is unclear why Europe is not using this vaccine in the over 60s, apart from the fact that, as we all know, there seemed to have been some supply problem to Europe, and that has there were discussions, for want of a better word, about the supply of Oxford to Europe. So I suspect that is why they're not giving it to the over 60s in Europe.
It's more of a supply thing or a Brexit thing or whatever than
it's not an
problem
efficiency.
with the.
Absolutely, it's not an efficiency thing.
Fine, and there's no doubt over the.
No,
that particular.
no, it works as well in those over the age of 65 as it does under the age of 65.
And just on the subject of that, of the different types of vaccine, if you receive a particular, can you choose what vaccine you receive?
No, I would strongly suggest that as soon as you receive an invitation to be vaccinated, you take that up and you take the vaccine that is there, and that will provide you with the immediate or near immediate protection that you need going forward. Delaying your vaccination till you get your preferred manufacturer is definitely not a good option.
And if you receive a particular type of vaccine for your first dose, you will receive that same brand for your or the same manufacturer for the second dose, or could it be anything?
That's the plan at the moment, but
Depending upon supply.
But people can. We are now told that people can receive as a second dose vaccine from a different manufacturer, and there is increasing thinking that that actually may be a good idea. If people do end up receiving a second vaccine from a different manufacturer to the first, they should not worry about it. That will give them the required additional protection with additional durability.
Right, thank you, Doctor. Ross, just to jump, Paul, just to jump back to you. I know you were answering the question previously there. We've had questions also from people who may have allergies or they're allergic to penicillin, things like that. Is there a list of ingredients that they can see what's in these vaccines to see whether they're going to get it, or what? Do they have to live the rest of their lives in isolation to make sure they don't catch COVID? How do these, there are quite a few people out there with varying allergies. How do they manage?
I think there was a lot of concern about this when the vaccines first came out, but the more recent advice is more reassuring. There are very few reasons why you cannot receive a vaccine. The main ones being you're actually allergic to the vaccine itself or to one of the ingredients in the vaccine. So people who are allergic to certain foods like peanuts or maybe bee and wasp stings, even if it's a severe reaction that requires an adrenaline pen, they are okay to receive the vaccine. It's only if you have got a severe allergic reaction that you don't know what causes it, or that it's to a range of different drugs that we need to be careful. And in those situations, it might be more advisable to use the AstraZeneca vaccine as opposed to the Pfizer vaccine, because one of the components in the Pfizer vaccine called polyethylene glycol, or PEG, is known to cause allergy. People don't know they're allergic to it until they receive the vaccine sometimes, so we don't know about it. But that's the main allergy concern with the Pfizer and the Moderna vaccine as well, for that matter.
So what do people do if they are somebody, or they do think there might be an ingredient? First of all, is there somewhere they can check what's in it?
Yeah.
And secondly, if they spot something that gets the red lights going, what do they do about it?
Yeah, so the MHRA, which is the UK Medicines Regulator website, has got
What does
information.
that stand for, sorry?
The Medicines and Healthcare Products Regulatory Agency,
Okay.
which is why I said MHRA. So they have information on their website for people receiving the vaccine, including the information leaflet, and that has a list of ingredients on there, so people can go and check that. Having said that, when they look at this ingredients, it might not mean much to them, so they might not know whether they're allergic to them or not. So if they're not sure, just ask, and we can advise them.
And Becky, did you want to come in on that as well?
On our website, on the right-hand side column, there's the information which gives you the patient information leaflet. So the specific drug information leaflet that Paul spoke about is on the website. So if you go on our website, it's on the right-hand side and it's got patient information. So the 2 drugs that we're offering at the moment, their ingredient list is on there, so people can go and have a look at there.
And which ones are we offering at the moment?
We've got Pfizer and the AstraZeneca.
And is there any possibility of using the Moderna one as well at any point?
Yeah, so we will be receiving that one, but we're unlikely to get that until probably the end of March.
Okay.
So as soon as that gets online, we'll be then advising the public that. Is it worth talking about the yellow card as well?
Yeah, I can do. It comes back to side effects. These are all new vaccines, and all the medicines regulators across the world are keen to understand what side effects are associated with them. And most of them are, as I've described earlier. But if people do have side effects, and that's any side effect they think might be attributed to the vaccine, they can use what's called the yellow card scheme. Again, I think we've got links to that on the website, and you can basically go in, fill in a simple form listing the side effects of the vaccine you had. That goes to the MHRA, who will collate all the information from the millions of vaccines that have been given to get a better picture of the sort of side effects that are coming out.
And then maybe warn other people in the future. Or
Absolutely.
they can look at ways of getting around that. Okay, that sounds a good idea. Dr. Muscat, we can see it staring at us there at the top of the list. Obviously, there's been lots of comparisons with our sister island throughout the pandemic, and we've had quite a few likes there of this question. Guernsey is giving the Pfizer second dose at 6 weeks and the Oxford second dose at 10 weeks. Why is Jersey giving the Pfizer second dose at 12 weeks, which is double the length that Guernsey is?
So we are following the MHRA and JCVI guidelines, and their guidelines say that we can give the second dose of either the Pfizer or Oxford vaccine between 3 and 10 weeks, or 3 and 12 weeks, and indeed after the first one. So we are aiming to give the second dose at around 10 weeks after the first dose, to allow for a little bit of elbow room in case the timetable shifts for that individual for some reason or another. We have always felt that if the MHRA, given that the MHRA and JCVI have all the data, the raw data, they have the expert analysts to look at that data. And that for us to say that their advice is wrong implies that we've got as much data as they have and as much expertise as they have. Well, we don't. We're not as big as them. We don't have that data. So we do take their advice and follow their advice. And of course, it allows for continuity as well. We have, if you like, anchored ourselves to their advice, and they are internationally recognized authorities. And we have always felt safe working under their umbrella.
So does that imply then that Guernsey have got it wrong? Are they?
No, that's not what I've said. The JCVI and the MHRA have said that you can give the vaccine 3 to 12 weeks after the first dose. So Guernsey are doing that. But they've chosen the 6 weeks, and we've chosen the 10 weeks.
But they're both within the guidelines.
They are both within the guidelines.
Fine. Okay. Thank you for that, Doctor. Now, whilst you've got your mask off to say you're taking it on off, I know that we had a question a bit earlier about if you are pregnant or breastfeeding. We've had a question here and a number of people have liked it, so maybe they missed that earlier question. And this is somebody who's come in who says that I'm young, I don't have children yet, but obviously they might want to in the future. And they are worried that the COVID vaccine could have an effect on their ability to have children in the future. And that's to quote them here, that's the only reason why I'm not convinced to get the vaccine. What's your response to that?
There is no evidence that the COVID vaccine affects fertility or future pregnancy.
So the advice is go and get it.
Indeed, absolutely. If it is indicated for you, then you get it when you're offered the vaccine. Do not delay. That is the greatest risk to an individual at the moment. And additionally, and millions upon millions of doses have now been given, so information is gathering all the time about the side effects of the vaccine, and there is no signal that it adversely affects fertility.
And another one there as well. If someone has had the virus, if someone's had the vaccine, including 2 doses, is it possible for them to still catch COVID?
Yes, it is. No vaccine is 100% effective even after 2 doses. But it is true to say for all vaccines actually that even if you do get an infection despite the vaccine, that the infection you get, the disease you get due to the infection is much subdued. So you may feel a bit off colour, but not seriously unwell. So you will always benefit from being vaccinated. So protect yourself as best you can. Get vaccinated.
That's quite a clear message there from Dr. Muscat. So just to remind you, we're doing our best to get through these questions. If you've got something that you want to ask, don't post it. If you're watching on Facebook, don't post it below. Obviously, you're free to express whatever comments you wish there. But if it's a specific question you'd like to get to the panel, jump over to slido.com, slido.com, enter the code 445566. That's the hotline number. We should all know it by now anyway, the COVID hotline number. Enter that code. It'll bring you straight through into the chat room. You don't need to log on. You don't need to download anything. Give your name, any personal details. Pop your question in there. Put your name on it if you want to. And we will do our best to ask that question for you. So I saw another question here, which possibly, Ross, puts you on the spot. But do we know what percentage of the population have received which vaccine? Have more people had Pfizer? More people had Oxford? Is it easy to tell?
So we know exactly what vaccines we've been giving to people. Clearly, early on, we only had the Pfizer vaccine available to us. So through all of December and through most of January, we were issuing mainly the Pfizer vaccine. Since then, the supply chain for the Oxford AstraZeneca has increased. We've been getting more doses of that through, so we've been able to use that as well as the Pfizer vaccine. But we use whatever vaccine we have available as soon as we possibly can. So that our focus is on getting people vaccinated, whether it's one or the other, as has already been discussed. They both give a great amount of protection, so therefore we focus on using whatever we have as soon as we have it.
Becky, just something here, whether this kind of strays slightly from your area of expertise, but I know you're surrounded by good people there that can help you. On a lot of people's minds, certainly in the UK news at the moment, is dominating this going on holiday and people wishing to already start planning to book. I mean, we're fortunate in Jersey that we can maybe enjoy the beaches and get some fresh air and some good weather that perhaps some in the cities in the UK don't have the opportunity to do, those people that live there. Somebody's here asking about, do you think in the future they'll be charged to be COVID tested? At the moment, they're not. Is there a plan to introduce that? And if so, if they've refused the vaccine, as this one questioner asked there, will they then perhaps have to pay for COVID tests in the future? Or what's the long-term thinking around that?
So, just so I'm clear, the question is around charging for testing?
Charging for testing, particularly if they've decided not to have the vaccine.
Okay, so the testing programme doesn't sit within my remit. So I think at the moment we're right at the beginning of our vaccination programme. So what does that mean as an island? What does that mean in terms of policy? Probably does need to be thought through the longer term, but at the moment we're quite in the early stage of the vaccination programme. So the government, again, will be looking at all the different policies as a result of it and examining that. So probably not a question for me, I'm afraid, but it is a really good question.
Yep.
And one that I know the government will be discussing and then relating that to islanders. But
So that's kind of policy and development, so
It
to
is,
speak, at the moment.
yeah.
And I mean, I suppose another one then, if you decide I'm not going to get the vaccine at the moment, for whatever reason it might be, further down the line, that individual decides, you know what, I really want to go on holiday, I can't be bothered isolating, or, you know, or maybe, sorry, it's not that they can't be bothered, they must isolate, but they decide I don't want to go through with that isolation, I might take the vaccine, get the vaccine instead. If they've missed their slot, can they decide then, oh, actually, can I have a vaccine now? I've changed my mind. Or is it too late? Or would they have to pay for it? That kind of thing.
There's quite a few questions. Shall I start and then I'll go to Ivan as well? So there's a few questions in that. So the rules still apply. So isolation is definitely something that people still need to do. So regardless if you've had the vaccine or not, you still need to take the public health advice. So whether that's isolation or even if it's just the public health measures, so wearing a mask, keeping a safe distance, those things are still really important. As I said, we're actually at the beginning of the vaccination programme. It needs to also be an international programme as well for it to have a really good effect. So we're at the beginning of this journey, so people still need to self-isolate and they still need to take the public health advice. And that's that, Ivan?
Yes, we're in the early days of vaccination. Data about its effect on transmission is only starting to accrue now. We now know that after one dose of Oxford, your transmission rate is reduced by 67% if you're infected, based on NHS staff having the first dose of vaccination. So that's relatively young, healthy people. The Pfizer vaccine is coming along with perhaps similar or better reduction in transmission based on Israeli data. But we don't know enough about it to be able to determine what will constitute an immune passport and what will allow international authorities to determine what an immune passport would look like, whether testing will be needed additionally, how long after vaccination will your immune passport be viable for, and so on and so forth. So there's a lot that we need to learn. At the moment, the principal emphasis is on using the vaccine to prevent disease and transmission of disease and to break the back of this pandemic. The additional benefits from the vaccine have yet to be better defined, but they will be there because that is what vaccines do. And if I may return to the previous question just slightly, there will never be any requirement to pay for COVID testing if it is indicated clinically.
What do you mean by that?
If your situation requires you to be tested for COVID,
Like if you was going to be admitted to hospital for an operation?
or had symptoms that may have been due to COVID or something similar to that, then that would not be charged for whether you've been vaccinated or not.
But perhaps if you need to be tested because you want to go and spend 2 weeks around the Mediterranean, then perhaps in the future.
In the same way as you pay for your ticket and your airport tax and everything else that goes with it, sun cream, you've got to put it in that context. But that is up to the policy makers and not. But from a clinical point of view, which is perhaps closer to where I sit, there would not be. It will be dealt with like a normal test.
Understood. Ross, I know you touched on it briefly, I think, or possibly was Paul, so forgive me. Somebody just asked for some clarification on that reporting of the side effects. Did you say it was a yellow card or something?
Yeah, it's called the yellow card scheme, and if you simply Google yellow card scheme, you'll get a link to it. But I'm sure there are links through our website as well. It's a very simple thing. You click on it. You don't need to give too much information. Just ask questions about what vaccine you received, what side effects you want to report, and it's as simple as that, and send that information in. And by doing that, the MHRA and other medicines regulators who do similar things around the world will get a much better picture of the side effects that people can expect from the vaccine.
Becky? Yep.
And that system is always in place. So the yellow card system hasn't been set up specifically for this vaccine. It's always there for all medicines. So as a person receiving a medication, I could report a side effect, but it's very commonly used by healthcare professionals to report side effects. And as Paul said, the MRHA are looking at really closely, because there's a lot of scrutiny around the vaccine, a lot of attention. So they're looking at all the reports that people are receiving or sending in, so that they can then quickly report to us, this is now looking like a picture of a side effect, and then they would be able to tell us about that. But they're looking at that, and they'll be able to advise us on other side effects that may become transparent through this yellow card system.
Yes.
Yeah, and I think one of the examples of how well that works has been the change in the advice on allergies, because the MHRA were able to see how many reports of anaphylaxis they'd had compared with how many doses were given, and the circumstances behind those anaphylactic reactions, and were able to amend their advice so that more people were eligible to have the vaccine, even if they did have allergies to foods or insect stings.
That's again reassuring to hear that the community is playing a role in helping the rest of the community there. Ross, I know that you're looking after the kind of the windows for different categories of islanders who are going to receive this. Somebody's asking, have you made the provision for parent carers of vulnerable or disabled children to have their jab? What's the plan there?
Yeah, absolutely. So we're currently going through the moderate risk group, and within that we recognise that there are a number of carers who are looking after people who rely on them to get by, so they are involved in that group. Those that are registered with Customer Local Services will be receiving a letter from them. If they do not receive that letter, or they don't receive a benefit for caring, then they can get in touch through their GP to make their situation known, and then be considered for that group and be invited forward to a vaccination.
Okay, right, thank you. Dr. Muscat, did you want to come in on that as well, or you happy with that?
No,
Now, we just saw a question there. I mean, this is you know, it's not just for islanders. The COVID pandemic's having an impact everywhere, and we've seen a question there coming in about people who have planned family events. In this instance, it was a wedding, I think. It's just dropped off the screen there. But can they in any way try and pay to get to the front of the queue so they can carry on and have their wedding as planned, or are they going to have to cancel that event?
Well, shall I answer this one?
Yes, yeah.
So the vaccine programme at the moment is about saving lives. So we're doing it based on the JCVI, which is really about doing it as quickly as we can to save as many lives as we can. So whilst we've got limitations in vaccine amount, we need to make sure that those at highest risk of dying from COVID, if they got it or had really serious effects, that we give the vaccine to those priority groups first. So we've made sure that we're giving it based on saving as many lives as we possibly can, as quick as we can, when we've got limited vaccine supply, because we do have a limitation in the vaccine supply that we have. So we're sticking to the JCVI, those priority groups at the moment. So we do realise, though, that people, and it's brilliant that people want their vaccine as soon as we can. That's what we really want as a team, to do that. But as vaccine supply is our limitation at the moment, we need to make sure we stick to that JCVI.
And I suppose lives come first.
Yes.
Yeah. Now, there's a really good question here that's come in, and maybe this is one for you, Dr. Muscat or Paul. I'm high risk. What if I'm high risk or severely vulnerable, having a blood cancer and treatment that gets my immune system compromised? Will the vaccine still work if you don't effectively have an immune system? How's that gonna work?
Yeah, I mean, I think yes, the vaccine will work and will have some benefit and will give you some protection. I think people who've got compromised immune systems or weakened immune systems might not get as good immune response to the vaccine, which is why it's important that they obviously complete the full course of vaccination, have the 2 doses to do that. But certainly they'll be much better protected if they are vaccinated than if they're not vaccinated.
Ross, a quick one here. Somebody's asking, obviously we know that these vaccines have a shelf life. If they're not used, presumably, if they're not used within a window, perhaps, or there's an assumption that they may have to be thrown away, they can't be stored forever. Is that happening in Jersey? And if so, somebody's asked here, is there like a standby list? Can I turn up at the end of the day if there's any, if people have missed their appointments, rather than it go in the bin, I'll have the vaccine?
Sure. Yeah. So the cold chain, as we call it, for each vaccine is different. So it involves, as we mentioned before, what temperature it needs to be stored at, what temperature it needs to be travelled at, and then once it's essentially in play, how long it can then be at fridge temperature or then out on the floor in use. So it's different for both vaccines, and we carefully plan and schedule to make sure that every vial that we take out of the cold chain for use is used with the minimum amount of waste possible. At the minute, the waste is very, very minimal, and we're doing the team are doing a very good job at managing those doses and making sure that all those doses that are in play are used. We do have, as I say, a limited amount of waste, which is unavoidable, and we try to again schedule to make sure that's as listed possible. We don't have an active list at the minute of standby people because we need to try and our best to stick to the JCVI guidance of only vaccinating those within the groups, and clearly the demographics that we're approaching at the minute and vaccinating aren't necessarily able to get up to the fort at late notice, and we'd have very limited ways of communicating that to people anyway. So we don't have a list, but we are continuously looking at how we improve that and how we minimise that waste, and open up potentially in the future to any other demographics that may be eligible for that.
I suppose you don't want a surge of people turning up every night at 5 to the closing time, just in case there's an off chance.
Yeah, absolutely
It's
not.
going to defeat the object of keeping everybody safe and socially distanced. Dr. Muscat here, somebody said a bit like when they have antibiotics, I've heard that you shouldn't drink alcohol for a number of weeks after you've had the vaccination. Is that true?
Well, you should always drink alcohol in moderation.
That's the doctor's answer.
So but there is no contraindication to having a modest or moderate drink after vaccination, none whatsoever.
Okay, and how long's that for?
Life.
Just to clarify, that's fine. Well, look, is the whilst you've got your mask off, Doctor, as well, we spoke about it earlier. Now we've gone slightly over the time, but I'm getting a signal that we're going to carry on for just a little while longer because there are so many questions coming in. We spoke about the Dr. Muscat. You spoke about the gaps and the gaps that we've got between our vaccines. And somebody's asked here about the reasons why we've opted for a 12-week, whereas other places may have gone shorter. We know that there's you've spelt it out, that there's the recommendations from the medical authorities that we work very closely with. We're within that window, but is any of that decision making impacted by supply, or is it all down to pure medical advice?
It all decisions about the rollout of the vaccine are impacted by supply because no one had been vaccinated. There was a pandemic, and then there was a supply of vaccine which wasn't infinite but limited by what could be produced. So that limitation was inevitable. And as a result of the known efficacy of the vaccine, a single dose of vaccine, as a result of knowing that you could actually create, based on the data and the analysis of that data, that you could create a larger gap between the first and the second dose, that actually creating a reasonable gap between the first and the second dose meant that the immune system from the first dose matured even better. than otherwise giving the second dose a better springboard to produce a higher degree of immunity and a greater durability. So knowing all that, and knowing in particular, trumping everything else, that giving as much protection to as many people as possible as soon as possible through using one dose, rather than halving the number of people you can protect, was the way forward in the middle of a pandemic. So a combination of those things meant that that was the best way forward.
All right, thank you for that. And before you put your mask on there was, we can see the question at the top of the list there. We've obviously there's a lot of people who are worried about pregnancy and future family planning, and we've received clarification here that there's still a concern there about not necessarily the ability to have children, but could that give the child that they have perhaps deformities or other illnesses?
There's absolutely no evidence of this whatsoever. So the clear advice from JCVI is that you do not need to ask, for example, when a lady's last menstrual period was, whether she might be pregnant or not, but to just go ahead and give the vaccine. Sorry, there's no need to do a pregnancy test before vaccination either. If it turns out that a woman retrospectively finds that she's pregnant, having had the first dose of vaccine, then there is no indication for termination of pregnancy because there is no indication of a risk of deformity as a result of vaccination or other illness. And that the only thing to do at that point is to determine whether the second dose of the vaccine should be given during the pregnancy or should be postponed till after delivery, based on the risk of COVID infection or risk from COVID infection to the mother.
Okay. Becky, did you want to add something there?
Yeah, I'd just like to thank people for raising that, because it's not something we've covered on our website in great depth. Obviously, we can sort of appreciate that that is a question that we probably missed. So thank you to Islanders for raising that and highlighting that actually that's a concern, because then for going forward, we can make sure that we put out better communication around that and we can give that information out. So thank you.
Yeah, it's obviously something that is playing on people's minds, and understandably so. On a kind of similar subject, Ross, perhaps this is you. What's the plan for school children and vaccinations? Will they be receiving them eventually as we work our way down the list? Or I know there's testing now in schools, isn't there? There's the lateral flow test. Or perhaps Dr. Muscat, is this one for you? I'm not sure.
So at the minute, from and Ivan, I'll hand over to you shortly, but at the minute, certainly from our planning, we're going down to 16-year-olds. So the two vaccine candidates that we have are only authorised for those 16 above for Pfizer and 18 above for AstraZeneca. So that's our current planning. So at the minute, we are concentrating on the over 50s and those with medical reasons, but some at higher risk, who are under 50, from 16 to 50. Once we move on to the under 50 category and we start planning on how we're going to roll that out, then we'll put more consideration into people under 16. But Ivan, I'm not sure if you can add anything to that.
Just a couple of minor points, really. So the clinical trials that were undertaken in adults, and that is why the advice is 16 or 18 and above. And that is the way clinical trials always start out. You start out with adults rather than children and pregnant ladies, for example, and so on. And then you build on that evidence as you go along. As it turns out, fortunately, children and teenagers get little in the way of disease due to COVID. They may get the infection, but it is often asymptomatic, and if they do get symptomatic infection, it's mild. Their role in transmission depends on age. It's likely to be greater the older they are. But as we go forward, we will be thinking about vaccinating children as well. We await sort of guidance and direction, if you like, from JCVI and MHRA, and they will be basing their advice on the clinical evidence that they have that this is the way forward.
So, I mean, just briefly before we finish, Ross, I mean, if you are a absolutely fit and healthy 19, 20, 21-year-old, When do you think they'll you would assume they'll be towards the back of the queue there because they haven't, the people with all those underlying conditions need to go first. When can they expect probably to receive the vaccination?
So as I mentioned before, our focus at the minute is still on the over 50s and the clinically vulnerable. We still aim to have a first dose for all of those people by the end of March. We will then switch to second dosing for that same demographic, which will take a number of weeks, if not months, depending on vaccine supply. Whilst that's going on, we'll be firmly planning how we approach the under 50 category, and more information will come out when it's available from that planning.
I mean, as a rough estimate, do you think maybe by the summer, by the end of the summer, by the autumn, by the end of the year?
Again,
when do you think we will have everybody with at least one dose? Or is it not, we can't tell yet?
Again, it's completely dependent on vaccine supply, what candidates are in play, what quantity we're getting them in, which is very, very changeable. So we wouldn't want to put a date on that or even a ballpark figure because it is so changeable. But we can rest assured that as soon as we do have vaccine available, we'll be using it straight away and getting through each tier group to get protection out there as soon as we can.
Fine. Right. Thank you for that, Ross. And thank you to all of this evening's guests, our panel of experts here who have been answering your questions on a very important subject to a lot of you, the COVID-19 vaccine and the programme and some of the theories and the rumours and that you've been hearing, but also the really, really specific questions. So even the panel here have learned some things this evening, which demonstrates how useful these type of events are. I can see there are still lots of questions that we haven't been able to ask. Please rest assured there is a team of people sitting behind the camera who have seen these, who will pick these up. Some of our experts here, as they have already this evening, will look through these. They may find patterns developing where they can address these online and put more information out. We hope that in the future we'll have more opportunities like this for you to ask your questions. And if there's anything specific that you've asked that you really wanted to get one of our experts here to answer, you can email that question to govevents@gov.je, govevents@gov.je, and one of the experts here will reply directly to you. So that's all from us for now. We hope you've learned something. We hope you found it interesting and useful. I wish you a good evening and stay safe.